Ooh, lots of messages. I guess, I want people to be affected. I really want people's eyes to be opened, their minds to be opened, and their hearts to just viewing and experiencing people in different ways. In particular, people who are struggling with mental illnesses, and I look at the challenges of people being able to work in the workplace, just being able to live their lives that we all want to do. I mean, that's a hope. I don't know what's going to happen, and I guess intuitively, my belief is that every person that walks into that theater is going to have something or some things resonate with them.
For me, I hope it's the beginning of a very long conversation. I hope it's the opportunity to start a long conversation about our assumptions about who we are and what we do and what affects us. And so this is specifically around mental health issues. And if that's an opportunity for me to talk to 6 people after the show is done and continue that conversation, then I've accomplished a great deal. So that's a really interesting word, stigma, and it comes from the word stigmata, which is literally a mark, and I don't know that that's the right word. I don't know, for starters, that stigma is the right word. I think a better word is prejudice, and I'm hoping that it will change some viewpoints about somebody's prejudice towards what they're seeing when they're walking down the street and they see somebody who may be ill, right? My daughter is prejudiced against every day. People with an illness are prejudiced against every day. And so that's a much more useful word for me than stigma.
Well, and the word that's useful for me is discrimination, because that's exactly what it is. And it's like the last bastion, of discrimination. And we went through this, 15 or 20 years ago with people who came out of the closet as gay. People do not want to be identified as somebody that's got a mental health issue. So, if we can help move things in the direction of eliminating that, then I'm all for it. And the other thing is that I want for people to step forward and come and play with me and my theater company, because the people who have had some kind of lived experience with mental health issues, I want them to come and play and do theater so that people can see that they are not marked. They're people like anybody else. So that's the big hope. Well, creation is always a struggle, right? It can be pretty painful. And I think, sometimes you'd have an idea and then we get feedback and you go back and work with the idea, and then you come back and you play with it and it would totally suck. Like it just wouldn't work. So those were painful. And I think part of it too is we could have broadened this to have everything included. And then it would have been too muddy. I think that was hard. We wanted to be specific, and we wanted to make sure that we covered all the bases in terms of what are the issues out there for people, right? Mm-hmm. That was hard.
Yeah, for me, it wasn't about it being hard. It was just, I get to go into a room with a bunch of actors and play for 2 or 3 hours. So, and to have conversations about what it is we're talking about, and to challenge them on what they're trying to do and why they're trying to do it and what they're trying to say, and that isn't hard. That's just pure joy. Hard part is watching my daughter come home from school if she's had somebody say something really horrible to her. That's hard. Making a piece of theater takes work, but it's joy.
Absolutely, yeah. And I think, you know, I love having my thinking challenged. And I know Sean was saying recently about picking on me all the time. And I like it. You know, give me something to challenge my thinking and change it too. So I think that actually helped us in our creative process, because we do want to challenge other people's thinking. Yeah.
Well, so I'll talk from children and youth, and maybe you can talk from the adult side. For children and youth, there is there's an amalgamation that's going on right now amongst a number of the child and youth agencies. Is that a good idea? I'm still sitting out here in the field trying to figure out if that's a good thing or not. There's also the Student Support Leadership Initiative. So what that is the school boards got together with the agencies and began to figure out how they could work together. There's some really smart things and good things happening there, and there's some things I think they're off the mark on. And so but they're doing something, right? And they're thinking about it. In London itself, as a city, you know, London's a great city, but it's fairly conservative. And that brings its own issues with it. I don't think, here's what's interesting. So my daughter has a number of supports that she has at school. She's really successful academically. She's off to high school next year. That rocks. And so why aren't we doing that for everybody else? Why aren't we doing that for every student who goes to a school? So they can all have a chance to be as successful as possible. And when it comes to children and youth, why is it that we treat children and youth separate from the medical system? I'm talking from a medical point of view. So we have the adult medical system, of which mental health is a part, and we have the child and youth mental health system, which is completely separate from the medical system. We're devolved to agencies and to schools. So it's not even recognized. It can't, you know, just by that simple fact that we don't get the same medical care that an adult patient would get, my daughter doesn't, then there's already a prejudice there right away. And why is it that if I want to challenge the school board, or I want to challenge the Ministry of Child and Youth Services about how children and youth are treated in this province, then why do I have to go through them? And because it's a medical illness. It's a diagnosed medical illness. But so why am I talking to a social worker? Or why am I talking to somebody who is in education? Why am I not talking to somebody who's an expert when it comes to thinking holistically about the wellness of somebody? If we had put as much effort into child and youth mental health issues as we have into the breast cancer and cardiac arrests and heart disease, we'd be so far down the line. Every day, all the time, there are families out there who are suffering. We came close to losing everything we had. And that was because we had to jump through every hoop. There was nobody there to guide us. There was nobody there to navigate. And in Ontario, or frankly anywhere in the world, that's unacceptable. It's unacceptable that the response is, well, you know, there's a 10-month waiting list. Well, if my daughter went into a diabetic shock, there wouldn't be a 10-month waiting list. She gets seen like that. But it's a mental illness. 10 months, 2 years, right? And how many parents have had to sign their parent rights over in the past to the Ministry of Child and Youth Services, so they become a ward of the state, so they could actually get the care they need. Then they got the care that they need. It is criminal. This is just criminal. So as a province and as a country, we need to do 1,000 times more. You know, I mean, suicide is the leading cause of non-accidental death among children and youth in this province. So that's more than all the diseases, everything combined. Suicide is the leading cause of non-accidental death in the province of Ontario. That's unacceptable. That's completely unacceptable.